Hello, Steve Adams here from Tiger Medical Institute with our Chief Medical Officer, Dr. Matthew McNamee. How are you doing today, Doc?
I'm doing good, Steve. How about you?
Good, excellent. So the topic today, we're going to get right at it, is the ravages of inflammation. Dr. McNamee, the question I want to ask you is, what is the big deal of inflammation and what are the implications for our cells and our overall body?
Right. Yeah. So typically what we're looking at is the most people are talking about when we talk about inflammation these days, and the consequences of that. We're talking about chronic inflammation. So, if you jam your finger in a car door, or you get a splinter or stung by a bee, you get a little bit of redness and pain and swelling involved with that. And that's a quick, basically, inflammation process that's designed to take care of the damage or the infection or whatever's going on, and then heal. And that's typically a quick process that's over within days.
Sure, and that's a good thing.
Yeah, absolutely. That's a good thing. So chronic inflammation is, it's listed in the name. Basically, it goes on for a while, and it can be basically silent. And a lot of people wouldn't know a lot of times what that may be. They may not have any symptoms, especially in the beginning. Chronic inflammation is associated, with 14 of the 15 top chronic diseases in the U.S. This is from the CDC, right? So 14 out of the 15 of them are associated with chronic disease. So it's not good, right? So we want to address that to prevent all of those chronic diseases, or ideally get ahead of the game, or address those to rewind the clock a little bit, and that those disease processes, if they have that, right? Or we can catch it earlier and address some of those contributing factors that will, basically drive some of those processes. So, chronic inflammation is very simplistically, it'll damage, your all the cells in your body, so basically head to toe, it can affect you. So,
it's one of the two major assaults on cells, right? Besides oxidative stress.
Absolutely. They can get inflammation from the inside. You can get it from the outside of the cell. It affects all your organs. Right. Brain, heart, gut.
Yeah, as you always say, the cells, if they're healthy, it leads to healthy tissues, which lead to healthy organs, which lead to healthy bodies, and so it's all related, isn't it? If your cells have inflammation, it's all through your body.
Correct. Yep.
Yeah. Right. Well, then, clinically, what are the common ways that you lower inflammation in your clients? Because you're very successful at it. I've seen you do this over and over with our clients at Tiger Medical. So how do you do that, Doc?
Well, I talk about this all the time. It's trying to figure out what's causing it, right? So what are the driving factors? Yep. So, one real quick note, I just ran a real expansive genetics panel on myself, and I am prone to runaway inflammation. That's just one variable, right? So genetics does play a role, and I have the genetics to create a lot of inflammation and not put the brakes on, right? So genetics is one component.
So Dr. McNamee, that informs how you would treat someone just like you versus someone who has those genetics.
Yeah, I was actually just talking to another colleague that we work with, another physician here, and was just sharing with her, because she's got some basically some issues around inflammation we were talking about, and I was talking about the DNA studies, or the testing that we do may be beneficial in that sense. Yeah, so that's one component. There's a bunch of factors related to the environment. Basically what you're putting in your body. So high processed sugary foods will really promote inflammation. Micronutrient deficiencies can contribute to that. If people are overweight, especially in the abdomen, that will really drive inflammation. If they have hidden infections that we're not aware of, that can promote inflammation. Looking at sleep, are they sleeping enough? If they're sleep deprived, that can promote inflammation. If there's chronic stress, that can drive the process. Things like
there's inflammatory lifestyle factors, right?
Sure. Yeah. The air we breathe can affect that in certain areas. Other toxic chemical compounds in the environment. can
Does poor
create.
sleep drive it? Does poor sleep?
Yeah, 100%.
Yeah. Okay.
Your level will be up. Maybe
Right.
they've done stuff.
So what you're saying is clinically, you really can't answer the question for me of how you treat it clinically because it's unique to each person. And then it comes down to, because it's unique to each person, it's a personalized, customized treatment plan in concert with lifestyle and habit change.
Yeah, 100%. Gut health's another really big one I didn't mention. I see that in a lot of people where the balance of the microbes is contributing to that, because we've got 70% or so the immune system's located on the other side of the gastrointestinal tract, right? And if that's dysregulated, that throws the immune system off, which drives the inflammatory process, right? So that's right. Another component as well.
In my example, I was a collegiate athlete playing football, and in my late 40s and early 50s, before I met you, I had generalized achy joints all over, and I was accepting it because I thought, well, I played football. I'm paying the bill for that, playing that sport. And when you started working with me, my inflammation was higher, elevated, and it came back down to where you want it. And what I noticed was I no longer had those. That was all gone, and I recovered quicker. I had, like, when I work out, I don't have the same level of soreness or achiness that I had before. So that's just my example, and that's the kind of thing that's possible.
Right. Yeah, 100%.
And it was lifestyle change. The big thing for me was changing what went in my body because we needed to address some gut issues. So, what are some common problems, Dr. Matt, that you're able to see tremendous improvement in that you've seen in our client base as a result of lowering their inflammation? Just to give people some hope here.
Yeah, common things, any sort of gastrointestinal problems.
Like reflux.
Heartburn, constipation, diarrhea, gas, bloating, things like that. Skin issues like eczema, psoriasis, like you said, joint pain, muscle aches, things like, brain fog, headaches, difficulty concentrating, sometimes anxiety and depression.
Sure.
Some of the weight gain around the abdomen can be affiliated, not only as a drive inflammation, but it can be kind of a component of inflammation as well. Mm-hmm. High blood sugars, so things like diabetes, cardiovascular disease.
So diabetes gets better if you lower the inflammation, meaning it's easier to manage, maybe a little less brittle.
Yeah, it's one of the components that will drive that process. It's one of them, right? So if we lower inflammation, ideally, your things should start working better in the system.
Right.
Cardiovascular disease is an inflammatory process, right, in the vessels of the cardiovascular system. Those are some real common things. Autoimmune disease, that's another inflammatory process. What
about in the long term now? There's people that have concerns about cognitive disease because of maybe relatives who've had it, close relatives, or they just know their lifestyle is one that maybe isn't good. Inflammation is also linked to that, isn't it? To future cognitive disease risk, elevating that risk?
Sure. Yeah, 100%. That's one of them. So Alzheimer's disease is one of those diseases in that umbrella, right? Mm-hmm. That is involved with inflammation as well. So, and even the other forms of dementia will have, typically the more common ones will have a component of inflammation as well.
Mm-hmm. So this is not something to trifle with.
No.
Right.
No.
Right.
You want to get get some knowledge base on where it's coming from and do the things that you can to, try to reduce your overall I call it like your inflammatory load, right? So what are all the things that are contributing to the overall load? Yep. And let's address those and, reduce that.
Last question, Dr. Matt, how is your testing that you do different than maybe like a traditional Western medicine practitioner who measures for it maybe in one marker how do you compare, like, to explain briefly, like what is the scope of your inflammation testing compared to that?
I would say typically I tend to see that I have at least, from a blood work perspective, typically have a few more markers of inflammation through the blood work. But that's not the only place we're looking. So we do, other types of blood work that will, and stool testing that'll look at gut health and inflammation. And we can literally look at, toxic inflammatory compounds that are secreted from bacteria that can get into our bloodstream and create a lot of inflammation, right? So I look at markers like that. The genetics is really unique, because they have an entire inflammatory panel on there that looks at all of the, different pathways that are involved with, creating inflammation and then, resolving inflammation, right? Yep. So I think that's really unique.
Okay.
Yeah. And then even looking at things like cortisol levels and such, right? Because that plays a role in inflammation. So I typically look at that in more of an advanced way as well.
And typically our clients come in with elevated cortisol levels, don't they? From stressful lifestyles that they all live.
Sure.
Yeah.
Mm-hmm.
Well, Dr. McNamee, thank you. You've been a wealth of information on this topic of the dangers of inflammation. I would encourage anybody that's listening, I think what you just heard was Dr. McNamee has a multi-dimensional view of inflammation from the various ways that he's able to examine it versus a simple panel, maybe single measure of it that is typically what insurance companies will approve. If you've got more concerns than maybe what you feel like that'll address, I encourage you to come to our website at tigermi.com. Go into our learning center and look around, and then you'll see a schedule a call button where you can speak to one of our pros here. And all we're going to do is really learn about your story, what your goals are, what you've tried in the past, and make sure that what we do is a good fit for you, because the last thing we want to do is have you join us and it's not a good fit. And if it's not, we'll try to help you find a good fit, because we want you to be successful wherever you end up going to get help. But if you suspect, if you're struggling with diabetes, or you think you might be pre-diabetic, or if you've got some weight challenges, you're not sleeping well, you're stressed, chances are you've probably got more inflammation than you want. And so this is not something you want to wait on. You want to address it. So thank you, everyone. Thank you, Dr. Matt.
Thanks, Steve.